Have you always believed that the more health checkups you get, the safer you'll be? What if I told you that, after age 70, some medical tests may actually harm you more than help? Yes, it may sound shocking. We've all been taught that prevention is the best medicine. But what if that very prevention is exposing you to unnecessary risks, dangerous side effects, and even surgeries you never needed in the first place? In this video, you'll discover 5 common health checkups that many seniors undergo, thinking they're doing the right thing, but that could actually lead to overdiagnosis, anxiety, and invasive treatments with little to no benefit at your age. You'll hear what recent scientific research has revealed, why some doctors are rethinking these routines, and most importantly, how you can make safer, smarter health decisions after 70. And at the end, I'll share a simple at-home test that costs nothing, takes 1 minute, and gives you real insight into your longevity. More than many expensive tests out there. So if you want to age with clarity, freedom, and confidence, stay with me until the end. What you're about to learn might completely change the way you take care of your health. Don't forget to subscribe, hit the like button, and share this video with someone who's over 70. And please, comment below and tell us, what country are you watching from? We'd love to know how far this message is reaching. Part 1: Annual Mammograms after age 70. This first one might surprise a lot of people. We're talking about annual mammograms in women over the age of 70. But wait, aren't mammograms life-saving? Yes, they can be useful, but not always. And not for every age group. The truth is, after 70, your risk of developing an aggressive form of breast cancer actually decreases, while the risks of false positives, unnecessary biopsies, and even invasive surgeries increase. Just imagine going through a test, receiving a suspicious result, enduring a painful biopsy, waiting for weeks in anxiety, only to find out it was nothing. Or worse, going through surgery to remove a tumor that never would have harmed you in the first place. Recent studies, like those from the US Preventive Services Task Force, show that for healthy women over 70 or 75, annual mammograms may not provide clear benefits. And even more, there's no strong evidence that it improves life expectancy in this age group. Of course, every case is different. If you have a family history or high risk factors, your doctor may recommend otherwise. But the key message is, don't just do it out of habit. Ask questions. Weigh the pros and cons. Because getting a test simply because everyone else does may be putting your health at risk. Are you still with us? Hit the like button and comment the number 1 below so we know you're following along. And stay tuned. Next, we'll talk about a checkup that seems harmless, but can actually damage your kidneys and heart after age 70. You won't want to miss it. Part 2. Contrast imaging tests after 70 now. Pay close attention to this one. Contrast-enhanced imaging tests, like CT scans or MRIs with contrast, can be a real risk after age 70, especially for those with diabetes, high blood pressure, or even mild kidney issues. That liquid they inject into your vein before the scan. It's meant to help highlight structures inside your body, But what most people don't know is that this contrast can overload your kidneys, sometimes dangerously. After 70, kidney function naturally declines. And when you inject contrast into the body, it can trigger a condition called contrast-induced acute kidney injury, which can appear days later with symptoms like swelling, weakness, and even mental confusion. And this isn't just theory. A major study involving over 180,000 patients aged 65 and older found that seniors were 2.5 times more likely to develop kidney damage from contrast than younger adults. It gets worse. Another study showed that 38% of hospitalized seniors developed serious kidney complications after a contrast-enhanced CT scan. And among younger patients, 0 on top of that. Contrast agents can also cause allergic reactions, from rashes and dizziness to, in rare cases, breathing difficulties. Now, of course, these exams are important in specific situations, like emergencies or when there's a strong medical reason. But if you're getting one as part of a routine checkup, just to see how things are, think twice. The risks might outweigh the benefits. If that surprised you, hit the like button and comment the number to below. That lets us know you're still with us and enjoying the video. In the next part, we'll reveal a medical test that seems mandatory for seniors, but in reality, it could lead to unnecessary diagnoses, stress, and treatments you may never have needed. Stay with us. This information could protect your peace of mind. Part 3. PSA tests in older men without symptoms. This one might be controversial. We're talking about the well-known PSA test, a blood test used to screen for prostate cancer. For decades, it was seen as a must for every man over 50. But today, many experts are warning doing the PSA test after age 70, especially with no symptoms, may do more harm than good. Why? Because the PSA measures a protein produced by the prostate. But this number can go up for many harmless reasons: a mild infection, inflammation, even riding a bicycle the day before. And then what happens? You get a high result. The doctor orders a biopsy, and suddenly you're stuck in a cycle of anxiety, pain, and risk of complications, often just to detect a type of cancer that would have never caused harm in your lifetime. Studies show that most prostate cancers found after age 70 are slow-growing, so slow, in fact, that men usually live with them for years without any need for treatment. But the side effects of that diagnosis and of the treatment can be life-changing. Urinary incontinence, sexual dysfunction, surgery risks, all of that when maybe you didn't even need intervention. That's why organizations like the US Preventive Services Task Force recommend against routine PSA screening in men over 70 who have no symptoms. Of course, if you have a strong family history or symptoms like difficulty urinating, that's different. But if you're feeling fine, sometimes the best care is simply doing nothing. If this is helping you rethink your health decisions, hit the like button and comment the number 3 below. Your engagement helps this channel grow and helps spread this message to people who truly need to hear it. In the next part, we'll cover a test that seems harmless but can actually lead to pain, inflammation, and even falls, especially in older adults. Don't miss it. This just keeps getting more important. Part 4. Bone densitometry test bone scan with excessive repetition. Many people believe that getting a bone densitometry test every year is essential to prevent fractures and osteoporosis, especially after age 70. But here's the catch. Overdoing this test can actually cause problems. Why? Because the test uses radiation, even if in low doses, and repeated exposure without real need can increase long-term risks. Also, the bone density result doesn't always accurately predict what will happen to your bones. The test measures mineral density, but doesn't directly assess bone strength or fall risk, which are key factors for fractures. Another important point: too many tests can lead to overtreatment, with medications that cause side effects like muscle pain, digestive issues, and even a higher risk of falls. Experts recommend that if you haven't had recent fractures or specific symptoms, bone densitometry should be done no more than every 2 years, or as advised by your doctor. So, no automatic annual routine tests. Always ask your doctor, do I really need to repeat this bone scan now? If you're learning and enjoying this info, please like the video and comment number for below. This really helps us and everyone who needs this content. In the next part, the last on our list, we'll talk about a common test that might be causing more anxiety and problems than it helps, especially for those over 70. Part 5. Routine cardiac checkups, stress tests, and ECGs to close our list. Let's talk about common heart tests, like stress tests and routine electrocardiograms, ECGs, in people without symptoms. Many believe that doing these tests every year is essential to prevent heart attacks and other problems after age 70. But the truth is, for those without symptoms, a history of heart disease, or very high risk factors, these tests can cause more anxiety than real benefit. Why? Because these tests can produce false positives, indicating problems that aren't actually there, leading to more invasive exams, unnecessary treatments, and even hospitalizations. This cycle can increase stress, affect sleep, blood pressure, and mental health, which ironically can worsen cardiovascular risk. Doctors and international organizations recommend these tests only when there are clear signs, symptoms, or relevant medical history. So if you feel well and have no symptoms, ask your doctor if you really need these tests. Bonus quick and free home test to check your health before we finish. Here's a bonus tip to help you monitor your health simply and at no cost: the one-leg balance test. Here's how it works. Stand up, holding onto a chair or wall for support if needed, and try to balance on one leg for 10 seconds. If you can do this without losing balance, congratulations! Your muscle strength and balance are good, which is a great sign for preventing falls and maintaining your independence. If you have trouble or feel unsteady, this could be a sign to invest in strengthening and balance exercises, and also consider medical evaluation. This test is simple, quick, free, and you can do it anytime to keep track of your health. If you enjoyed these tips and want to keep getting valuable health and wellness content, Like, share, and comment number 5 below. And don't forget to subscribe to the channel so you never miss new videos. Thank you so much for staying with me until the end. Your health deserves care, and quality information is the first step.